All right. Well, welcome everybody. I'm Dr. Miguel Reguero. It's wonderful to have everybody here at DDW. Hopefully everybody's having a great meeting. If you're looking for the MASH presentation, stay in this room because this is going to be much more exciting. We're going to talk about IBD and IL-23. Along with my colleagues, who I'm going to introduce in a minute, we certainly will have time for discussion. Please feel free at the end. If you do have questions, we'll go through how to format those, but we would be open for any questions about IL-23 and IBD. So on behalf of CME Outfitters, I would like to welcome and thank you for joining us today for this educational activity called Visualizing the Future, Advances in IL-23 Targeted Therapies in the Treatment of IBD, which you're hearing quite a bit about at this meeting. So today's activity is brought to you by CME Outfitters, who's jointly accredited in providing continuing education for the clinicians worldwide. I just want to make sure we're clicking through. Okay, so follow us on Twitter at CME Outfitters for the upcoming CME CE opportunities, healthcare news, and more. Just to show in the back, can you guys hear me okay? I just want to make sure. Wave, good, yes, lots of hands flying up. We have about 600 people also online, so I'll wave to our online participants. Thank you for registering and joining us today. This proves to be a great program. So without further ado, I'm Miguel Reguero. I'm Chief of the Digestive Disease Institute, Professor of Medicine at Cleveland Clinic in Cleveland, Ohio. And sitting to my left is Jessica Allegretti, who's the Medical Director, Infusion Center, Director.
Don't read all of them, don't read all of them.
Everything. Jess, do you want to say hi?
Hi, everyone. Happy to be here.
And then to her left is Dr. Ed Loftus, the Maxine and Jack Zero Family Professor of Gastroenterology, specifically in IBD at Mayo Clinic.
Hello.
And then sitting to his left is Angelina Collins. Angelina, welcome as well, a board-certified adult nurse practitioner, inflammatory bowel disease at UC San Diego. We also know that there are a lot of APPs online and in the room, so we think it's important that we have this collaborative effort and presentation between our physicians and our APPs as well. So welcome, Angelina.
Thank you.
So today we're going to evaluate the role of various pro-inflammatory cytokines in driving inflammation and the pathogenesis of IBD. I'd also like to take the opportunity, you're hearing quite a bit about IBD and cytokines at this meeting, so we're going to break that down a little bit more in detail tonight. We're also going to assess the potential clinical implications of these IL-23s, identify the role of IL-23, Th17 inflammatory axes, and then we are going to start with an audience response. So this is a time where please pick up your iPads. If you haven't already logged in, you will see the questions here. And these are too small for me to read, but these are going to be the top 3. You can actually pick the questions, drag it up in the order of importance for you. Top 3 that you can have at this point. Use the microphones.
Yeah.
How's that? Better? All right. So just take a minute to top 3 answers here, and then we'll talk about this in a second. Little music. People are settling in. Drag. If you make a mistake, you can't make a mistake dragging up and down. Be curious to hear what people say about this. Access is one of those answers, and maybe our panelists, when we see the responses, can comment as well. All right, so what's the most difficult aspect for patient care? Pick your top 3. So it looks like, what do you think, Ed? Drug positioning?
Yeah. So then there's 3 tied for second, right? Prior auth, loss of response, lack of time with patients.
Yeah, so I think all of you are feeling the pressures of, and I kind of seen the body language of people in the room, this isn't surprising. So accessing the medicines, getting authorizations, time with the patients, but also still quite a bit of questioning around drug positioning. So Angelina, when we come to your section, this will be good for us to discuss as well. So with that, I am now going to turn it over to Dr. Allegretti, who's going to present the first part of this. And for the AV people who are doing this, we're not quite in sync on our screen, so you have that there. So Jessica, go ahead and tell us about the pathogenesis of IBD.
So, hold on, I just want to make sure this is the first slide we're supposed to be on. So what we're looking at here is really, my microphone is so much louder than yours. So we're really setting the stage. Again, we're really going to try to give you guys some good background on how these novel mechanisms work so that when you're thinking about which drugs to select, you'll have a better understanding of really what's going on even at the cellular level. And so what you're looking at here is a monocyte, a CD64 positive monocyte that's releasing a lot of cytokines that is essentially activating Th17 cells that's leading to downstream inflammation of the gut. And we're going to go through this process in a little bit more detail. So if we think broadly about IBD pathogenesis, we know it's multifactorial. There are various genes that have been associated with these set of diseases. We know there's environmental factors. The gut microbiome certainly has been implicated. And with regards to immunology, we know that immune dysregulation and skewed lymphocyte populations and altered cytokine production are simply playing a role in the pathogenesis of both ulcerative colitis and Crohn's disease. We know that a lot of these cytokine connections overlap with a lot of immune-mediated diseases, and that's why we see a lot of overlap with regards to the medications that we use. We share a lot with our rheumatology and dermatology colleagues because these pathways overlap. And so we're here to really focus on IL-23. So why target IL-23 in IBD? Well, inhibition of IL-23 decreases mucosal inflammation and improves epithelial barrier integrity. Inhibiting IL-23 suppresses gut inflammation in T-cell-mediated colitis, and anti-IL-23 therapy preserves protective IL-17 gut function. And when trials of anti-IL-17 have been trialed, they actually lead to worse outcomes. So again, that's a mechanism that we do want to protect. So where does IL-23 come from? Where there are several sources. You can see here macrophages, dendritic cells, neutrophils. All are IL-23 producers that have downstream effect on various cells that have IL-23 receptors. And IL-23 has been shown to be highly expressed in inflamed mucosa and IBD, and that's true for both Crohn's and ulcerative colitis compared to healthy controls. So IL-23 drives development of inflammatory pathogenic Th17 cells. So let me show you what that means. So we have T-cell activation, which again leads to inducible Th17, and then you get sort of this downstream effect again of release of more cytokines and sort of this pathogenic Th17 inflammatory response, and you see upregulation of things like TNF and IL-22, IL-17, things that we know to be pro-inflammatory. Sorry, we're back to an audience response.
So the next audience response, so think about this, you probably see in your practice a lot of patients who are on TNF inhibitors, and then over time they actually lose response. I'm going to actually check something. Can you hear me better with this or with this? So use the microphone.
Okay.
Got it. All right. So this question is, which of the following is a potential cause of anti-TNF non-response in patients with inflammatory bowel disease? Drug interactions between anti-TNF agents and immunomodulators, heightened production of IL-23 and development of apoptosis-resistant T cells, downregulation of TNF-alpha receptors on monocytes, or maybe many of you in the audience are thinking, I don't know, and that's an okay answer. So we're going to do a pre, and then we're going to come back to this and we'll do a post. So for those patients where you use anti-TNF and they lose response or they don't have a response, why is that? Take a second, and then just when the time comes we do the post, I will call on you first to see if they got it
Well, I'm gonna teach them
You're going to teach them, so it's going to be nearly 100%.